Welcome back to West Texas View.
I'm very happy to introduce you to another one of the Texas Tech University Health Science Center, Laura Bush employees, and this one is Christina Granada, and she is the administrator of the facility and does a lot of things. And I want you to give us the scope of your job, but before that I want you to tell us a little bit about you and how you arrived at the Texas Tech Laura Bush Institute.
Well, Texas Tech was not ever a plan of mine. It's not something that I set out to do. It kind of came by the wayside, and I'm very thankful that it did. I started out here in Midland in 2008 as a non-traditional college student. Actually, it was 2006. Started at Midland College, and I had a passion for law, so I went into the paralegal program there and went through for 2 years there and finished up. And then I realized maybe that's not what I wanted to do. As much as I had a passion for law, it just wasn't what I thought it was going to be. So I went into UTPB in 2008, and I started working on my sociology degree. There and again, it showed me a lot of different things, but I wasn't sure what I could do with the sociology degree in Midland, Texas. I was then working at Midland College as I was a secretary there, and I kept that
going
job.
To school and
going to school and have a little one, so it was a lot of different things. And so I thought, well, okay, we'll just do this secretarial job for a little bit, which I did, and I enjoyed it. And then I found out about this job at the Laura W. Bush Institute for Women's Health. And I thought, if nothing else, it was a big title and it would be fun. So I decided that that's what I was going to try out. So I applied, and luckily I was chosen. And then I started in on this job that I wasn't sure what it was all about. I had seen different things in the office, but I didn't know how that whole piece of the puzzle fit together.
And it would have scared you to death if you'd have learned all of that at the
Yes,
beginning.
I probably would have turned and ran. So anyway, I stayed with it, and I'm now learning how to do many different things within the community. The Laura W. Bush Institute for Women's Health, it is a big organization within Texas Tech. It's an institute within Texas Tech, and they focus on women's health through research, community outreach, and education, many different aspects of things. And so my job is, I'm the one that coordinates different events for Dr. Chupp to attend, different events for her to hold. Any of the research, I help. Once the funding is gathered for that research, I help to distribute that funding. And so it's a lot of different aspects of what I have to do. There's a lot of nooks and crannies that I never knew existed. And of course, having to deal with Texas Tech on one end of the deal, and then on the other end, you deal with the community or somebody totally different outside of the community.
And so, the network in other communities even.
Yes, we do. So there wasn't a blueprint for my job when I got to my office. There was just boxes everywhere. And so I was a little concerned, and I've been there a year, and I'm trying to find my way, and now I think we kind of have an idea of what needs to happen, how it needs to happen, and how it all works. So it's been a learning experience, and it's, you know, Dr. Chupp and Lisa, they make such a wonderful working environment.
So you've got a great team there.
We do, and we kind of stick together, and so it's fun.
But don't you have a lot of pride in the way that this is affecting the whole community?
I do.
Because when you reach out and are taking care of the women and children, especially the women and young female children, then you are really making a difference in this community.
Yes, and one of my main goals as I was going through school was to help people. I didn't know how, and I didn't know with what, but I knew I was going to find a job that would help people, and I think this is really what I was looking for. There's all different things that I do. I sit behind a computer most of the day, yes, but also we get to go to baseball games because we're talking about our adolescent healthcare project. You know, we're going out into the community and meeting different people that way. We're, you know, constantly on the move and looking for new and innovative ways to advertise, get the word out. Some people don't know that the Laura W. Bush Institute for Women's Health is here in Midland, so we're trying to get the word out and let them know that we're here.
And that's a really important point, because a lot of people don't really understand what the Texas Tech University Health Science Center is.
Right.
And so when you stop to say it's education for medical professionals, it's also a research center so that we have bigger and better opportunities in medicine for our population, and it's all and for our specific population, but it's also an opportunity for you to come in and be cared for, either through preventive medicine or care for some problem that you have health-wise. So they don't realize that these doctors are practicing physicians as well as teaching physicians. So these are some of the things you're helping do as the community coordinator.
Yes, ma'am.
And so you have loved that job. I can already tell.
I have. I sure have. We're like I said, we're learning as we go. We've started to attend the Comunidad en Acción Pachangas that are being held throughout the summer months in Midland. And the first one we attended was just a couple of weeks ago, and it was kind of funny, to say the least. We were out there not knowing what to expect, you know, not knowing what to take with us, but we learned a couple of things. We bought a canopy. It was hot. So
but
we're learning.
You can relate that people come to see you and they don't really know what to expect.
Right.
Or they talk about joining in one of these trials and they don't really know what to expect. So we're all learning together in this project.
We are. And with this project that we're working on currently, it's very user-friendly, you know, and I think when people think about research, they don't understand it completely. How does research happen? I think, and I do it myself, I see research and I think, oh wow, are they going to put us in these little rooms and watch us, or what are they going to do? You know, it's
simply a matter, you've got some instructions and they're notating these instructions.
So, you know, a lot of people don't understand that, you know, that they don't have to have any training or anything to be in a research project, you know, and I think a lot of people are scared. So we're hoping that through doing this project, letting people see what's going on, it'll break kind of the cycle of that. So.
And you mentioned that you're going into this Hispanic group, and one of the things that we have to think about in West Texas is we're rural, and that's a special population. We are very diverse. That's a special population. And then when you talk about the female situation, that's a special population. So this trial is really aimed at all of these. We're going to have to take a break, and we'll come back and complete this conversation about about the Texas Tech University Health Science Center. Join us in just a second.
Stay tuned. West Texas View will be right back.